Hi everyone, and now let's solve the questions of forensic medicine of recent FMGE exam. This time, all the questions of forensic were very easy. Let's see all the questions. First question, the description or study of death and dying and the physical mechanisms of conversion from cellular death into molecular death is called as. Basically, this is a direct question, definition of death. Right? Study of death is called as thanatology. We have learned in our class, right? So study of death is called as thanatology. What about other options? When I see option number D, entomology is what? A study of insects. Option number C, this is all about poisoning. And option number B, this is all about mechanical injury, right? Mechanical injury. So a study of death is called as thanatology. One-liner question. Direct question. Okay, question number 2. Which of the following tests is not used to assess the blood stain? Out of option number A, B, C, D, C, A, C and D. These are the tests which we are using to detect blood stains. See, a spectroscopy test, this is most reliable test. This is most reliable test to detect blood stains, old or recent. When we do microchemical test, yes, Takayama test and the Teichmann test. So these tests we are using to detect blood stains. But what about option number B? Very important and repeatedly asked question, Florence test and Barberio's test. These we are using to detect what? Semen stain. Semen stain. We have learned all these things frequently. So out of these 4 options, obviously, Barberio test is not used to detect blood stain, but seminal stain, right? See, always remember some important points related to Florence test and Barberio's test. See here, the mnemonic was FB. In the Florence test, there will be formation of brown crystals right now. And this is because of choline. This is because of presence of choline from seminal vesicle right now. Barberio's test, BY. Here you are going to see yellow needle shaped crystals, right? Like yellow needle shaped. Alright. And this is because of presence of spermine. So remember here, Florence test and Barberio's test related to seminal stain, repeatedly asked questions. Now question number 3. The muscles which are directly going into spasm just before death and remain rigid even after death. This is considered as, see option number A, B, C, D. When I talk about rigor mortis, algor mortis, liver mortis, all these are early signs of death, right? These are the signs of molecular death. Rigor mortis means what? Rigidity of dead body. Algor mortis, cooling of dead body. Liver mortis, staining of dead body. So when we see the question, C and D are not related to the question. There can be confusion in rigor mortis and cadaveric spasm. Let's understand here. Rigor mortis, this is completely a post-mortem sign. This will start after minimum half an hour after their death, right? So this is completely a post-mortem sign. But what is given in the question, the muscles which are directly going into spasm just before death. So this is actually in the question they have asked related to ante-mortem sign. Rigor mortis is not ante-mortem. Rigor mortis is completely post-mortem. Let's understand this one. See here, when you see these pictures, what is your analysis? Picture number 1 and picture number 2. Picture number 1, here a person has shot himself. Picture number 2, this describes what? Drowning. So basically when I see picture number 2, I can understand that before death, person was struggling. He wanted to hold something, but during the drowning, he could hold only some plants or weeds, right? So always remember that the group of voluntary muscles which were at strenuous work just before the death goes into a sudden state of stiffening instead of passing to primary flaccidity after death. This is called as cadaveric spasm. This is called as cadaveric spasm, which is also called as instantaneous rigor. Now, what is the meaning of this part here? Just before that goes into a sudden state of stiffening instead of passing to primary flaccidity after death. I hope all of you remember what I have taught during the class, that for rigor mortis, first of all, there will be primary relaxation. After that, there will be rigidity or rigor mortis. After that, there will be secondary relaxation or flaccidity. So this is the rule for rigor mortis, that first of all, there should be flaccidity. And after a few hours, there will be rigidity. And after that, there will be again flaccidity. Rule of 12 is also there. No? It takes approximately 12 hours to appear. It takes approximately 12 hours to persist, and it takes approximately 12 hours to disappear, right? So this is the rule, that first of all there should be flaccidity, after that rigidity, after that again flaccidity. But cadaveric spasm, this is completely antemortem in nature. What is happening here? Only voluntary muscles which were at a strenuous work just before the death suddenly goes into a spasm without going into primary relaxation. This is called as cadaveric spasm. So picture number 1, picture number 2, these describe what? Cadaveric spasm. This will give you the last attitude of the person before death. So how to differentiate rigor mortis and cadaveric spasm? First of all, rigor mortis is completely post-mortem in nature. Cadaveric spasm is ante-mortem in nature. First difference. Rigor mortis, first of all, there will be primary relaxation. After that, rigor mortis, and then secondary relaxation. But cadaveric spasm, directly there will be rigidity. Always remember that cadaveric spasm cannot be produced artificially. And third difference. In a rigor mortis, there will be involvement of voluntary as well as involuntary muscles. But in cadaveric spasm, only voluntary muscles are involved. Only voluntary muscles are involved. So all these are very, very important points. So as per the question, answer will be cadaveric spasm. Cadaveric spasm. Right? Because, see the question again. Muscles which are directly going into spasm just before death, antemortem in nature, and remain rigid even after their death. Fine. So I hope all the points are clear to all of you. Okay, question number 4. See, this is about liver mortis. Basically, discoloration of dead body, staining, fine. As we have learned that liver mortis is because of the nature of hemoglobin, right? Ideally, naturally, there is purplish color because of deoxyhemoglobin, right? But in this question, cherry red color is seen in a case of burns because of carbon monoxide poisoning. When carbon monoxide enters the blood, okay, this is going to take hemoglobin away from the oxygen. Oxygen will be there, but there will be a formation of carboxyhemoglobin. Oxygen is there, but hemoglobin is not available to utilize it, fine. So there will be situation like anemic hypoxia, fine. Oxygen is there right now, but separated. So cherry red color will be seen in carbon monoxide poisoning. Cyanide poisoning, there will be brick red color or bright red color. There you are going to see which type of hypoxia? Histotoxic hypoxia, because cyanide will be blocking cytochrome oxidase enzyme, right? After that, tissues will not be able to utilize the available oxygen. All right. What about option number D? Hydrogen sulfide, right? No, H2S. This will make sulf hemoglobin. So because of formation of sulf hemoglobin, there will be bluish, greenish discoloration, right? So in this question, answer will be carbon monoxide poisoning. Question number 5. An accused person died in lockup during the police interrogation. Inquiry in this case will be done by whom? In India, we are practicing two types of inquest. One is called as police inquest. Another is called as magistrate inquest. Police inquest is performed under CRPC 174 and magistrate CRPC 176. Police inquiry should be done in a case of murder, suicide, homicide, or death by machines, animals, or any kind of unnatural death. Okay, fine. But what if death has happened under the police custody or during the police interrogation? At this time, there should be inquiry done by higher authority. Now, in this situation, inquiry will be done by magistrate, right? So, in which condition there will be inquiry by magistrate? In a case of A, B, C, D, E, we have learned it. Death in a case of asylum death like a psychiatric hospital. B for Boston School, jail for juvenile. C is custodial death. D for dowry death. E for exhumation. In all these conditions, inquiry will be done by magistrate. Now, there are two types of magistrate inquiry. One will be judicial magistrate, one will be executive magistrate. Obviously, judicial magistrate can do inquiry in all cases, but specifically when I talk about executive magistrate, they are supposed to do inquiry only in the case of dowry and exhumation. But out of these four options, there is only one option related to magistrate, right? Apart from that, there is police superintendent, right? Police IG, head constable. But option number B, this is related to executive magistrate. So answer should be B only. Question number 6. Skull of a dead person was found during investigation. Police asked the relatives to bring the photo of deceased. Which method is being used for identification of dead body? Option number A, anthropometry test. Okay, this is also used for identification, where we are going to assess the proportion of body, where we are going to see the physical variations. All right. Option number B, okay, dactylography, that is fingerprinting. Option number D, DNA fingerprinting, where we are going to identify with the help of DNA. What about option number C? What about option number C? Superimposition. What is this? This is the exact answer for this question. What is happening in superimposition technique? See this one. Suppose if the skull is found, and what is happening here? Superimposing an image of the recovered skull over an ante-mortem image of the suspected individual. See this one, right? Now this is called as superimposition technique, and with the help of this we can identify the deceased person. So here answer will be superimposition technique. See question number 7. If an alcoholic person or unsound-minded person commits any crime unconsciously or unintentionally, it won't be considered as a punishable offense. This is defined by which of the following law? Please understand here that option A, B, C, all these rules are related to criminal responsibility of insane. See option number B and D. These are outdated now. Now we are using McNaughton's rule, which states that if an insane person or unsound-minded person commits any crime, this will not be considered as a punishable offense because he does not understand the consequences of the crime. This is called as McNaughton's rule. Answer is A, which is defined by which IPC? It is defined by IPC number 84. Now option number D, Locard's principle. This is related to Locard's principle of exchange. This can help you in identifying the main murderer or main main person who committed the crime. So what does it state? Locard's principle of exchange. When two bodies comes in contact, for sure they are going to exchange something. And because of that, you can reach to the real criminal. Question number 8. A combination of asphyxia due to any trauma and smothering is called as what? Let's understand all these four one by one. See here, when external respiratory passages like nose and mouth will be blocked, this will be called as what? A smothering. Smothering. When internal respiratory passages, when this will be blocked accidentally, then it will be called as choking. But homicidal blockage of internal respiratory passages by pushing a cloth or paper into the mouth, this will be called as gagging. Okay, fine. But what about this picture? See here, in a case of a stampede or in a case of building collapse, in a case of road traffic accident, railway accident, when a heavy object will be there over the chest of a person, and after that there will be mechanical obstruction where he cannot breathe in and out. This will be called as asphyxia due to trauma. This is called as traumatic asphyxia. And because of this, obviously there will be severe congestion. You can see cyanosis over the upper part of shoulder, neck and face. And this is called as mask ecchymotic. So now when I show you this picture, this is a case of asphyxia due to trauma. And when I show you this picture, this is what? This is a case of smothering. Examiner has asked what it will be called as when there will be combination of smothering and asphyxia due to trauma. This is called as burking. This is called as burking method. Burke and Hare, they were two friends. So whenever they wanted to kill someone, like they used to invite them, they used to offer the person alcohol. And when that person was about to lose the consciousness, okay, one friend used to sit over the chest and block his nose and mouth, and one friend used to pull the legs and drag around the room. So this was called as burking method of killing. Burking method of killing. This was the combination of a smothering and traumatic asphyxia. Right? So answer is what? Burking. Now what is the meaning of mugging and what is the meaning of garroting? Let's understand this part. See here, when a rope is thrown from behind, like picture number 1, and after that if there will be ligature strangulation, this is called as what? This will be called as garroting. This will be called as garroting. When two bamboo sticks or rods are applied around the neck and after that there will be neck constriction, it will be called as 𝗏𝗄𝗏𝗄𝗏. Right? If you are going to kill someone under the bend of your elbow like this, it will be called as mugging. And what about this picture? This is a type of garroting where iron collar rod is applied around the neck. And after that, there will be screw fixation. There will be neck constriction. This is a judicial method of execution in Spain. This is called as Spanish windlass. Spanish windlass. Remember, this is a type of garroting. This is a type of garroting. I hope all these points are clear to all of you. Next question. Confidentiality is maintained in which of the following? See if this is the right question which I have got from the student. See here, when I talk about the confidentiality, I should understand here that this is a type of professional secrecy, in which condition you are going to maintain the secrets of the patient, you are going to maintain the confidentiality. When I see other option like group discussion, panel discussion, seminar, all these will be happening in front of the people, right? In front of the people. So, and especially when I see option number B, which is called as the counseling. When I do personal counseling, obviously I should maintain the confidentiality of the patient. So answer will be here counseling. Now, a witness is asked to provide the fact in person by the court of law. This is called as oral witness. This is called as oral witness. What about documentary witness? When a document is supposed to be presented in the court, that will be documentary witness. All right. Here say an expert. First of all, let's understand expert witness. Who will be called as expert witness? A doctor will be considered as an expert witness. A firearm expert, writing expert, right? So these people are expert witness who are supposed to give their expert opinion in the court. What about hearsay witness? See, when I talk about common witness, who is called a common witness? See the example, if A and B were fighting on the road, C was watching them. Okay. Now what happened? Suddenly A opened his firearm and he killed B. This was seen by C. So C will be called as eyewitness. C is a common witness here. He will be called as eyewitness, right? Eyewitness. Now C is running towards police station to file a complaint. When he was running towards police station, suddenly D came in between. He asked C, hey, what happened? What happened? Why are you running so fast? Now C told D that A has killed B, A has killed B. Now D will be called as hearsay witness. Fine. So easy to understand. So in this question, answer will be oral witness. I hope all of you have done a great job. All of you have marked the right answers. I wish you all the best. Thank you so much.